Andrew. I'm Open University nursing student. I'll be just kind of asking a lot of questions just based on all your body systems, okay?
Okay.
So to start, can you just tell me just about your general overall health?
Overall, I consider myself pretty healthy. I could work out a little more, lose a little weight, but I haven't had any recent sicknesses. I haven't had the flu for several years. Just basic allergies, but besides that, I'm pretty healthy.
Okay. So we're going to start with just some questions about your weight. What is your current weight right
It's
now?
200.
200?
Yep.
Okay. Are you happy with that weight or do you want to lose weight or like how are you with that weight, with that number?
For the future, I'd like to lose probably 20 to 30 pounds.
Okay. Have you gained this weight recently, or is this kind of accumulated over time?
It's probably accumulated mainly over high school.
Okay. Have you experienced any weight loss
No.
recently? Okay. Do you experience any fatigue? Okay. Have you experienced any sudden weakness in the past where you just can't get things done, you're having a hard time walking around the house, just any weakness in general?
Nope.
Okay. Any recent fever or chills or flu or cold-like symptoms?
Nope.
Okay. Any unexpected or unexplained night sweats throughout the night?
Nope.
Okay. Do you have any history of any skin diseases?
I do have like a psoriatic type symptom that I get when it gets dry in the winter.
Okay, has this been diagnosed?
Yeah, I went to the dermatologist. I think they just called it like a dermatitis type thing, but she said it could be psoriasis.
Okay, what age were you diagnosed with this?
That was last year, so I was 18.
Okay, do you take any medications for it, or do you use any skin creams or
I
ointments
do
for it?
have a skin ointment. I'm not sure what it's called, but I do
Okay.
have a skin ointment for that.
Okay. Have you noticed any skin color changes or any pigmentations in any parts of your skin? Okay. Are there any moles that are present on your body currently, and have they changed in size, color, any irregular borders, any pain or bleeding?
I did have one removed several years ago, probably 3 or 4 years. And then I had one like on my upper chest, but the nurse practitioner said that it wasn't anything to be worried about.
Okay. All right. What age were you when you had that removed?
Actually, this one I was probably about 15.
Okay. And what about on your chest?
She looked at that this year.
Okay. All right. Have you experienced any excessive dryness or moisture to your skin?
Not recently, but in a few months, probably yes.
In the winter
Dryness,
season, do you
yeah.
notice? Okay. Is this annual thing, or is this something that just kind of started occurring at
Mainly
a certain
since
age?
college. I don't know if the dorms are not as humidified, but
Have you seen anybody for this, as far as a physician or a nurse practitioner?
not really. I
Okay.
mean, I may have mentioned it, but they kind of acted like it was normal.
Okay. Have you experienced any unusual bruising, rashes or skin lesions to any part of your body?
Nope.
Okay. How much sun exposure do you get annually? And if it is quite a bit, do you use any protection as far as sunscreen, sun caps, anything to protect yourself?
Well, I pretty much never wear a hat. As far as wearing sunscreen, mainly if I'm just going out to the pool, but not every day really at all.
Okay. How much on a mild, moderate, frequent scale? How often would you say you're exposed to sunlight?
Probably moderate.
Moderate. Okay. Any recent changes in your hair or any unexpected hair loss? Okay. Any changes in any texture to your hair?
Nope.
Have you noticed any recent shape changes to your nails?
Nope.
Have you suffered any? Have you noticed any increased brittleness or any unexplained brittleness to your fingernails? Any color changes to the nails, bluish? Have you noticed just any color changes whatsoever?
Nope.
Okay. Have you experienced any unusual or frequent headaches or dizziness?
Nope.
Okay. Have you suffered any head injuries in the past?
Nope.
Okay. Have you experienced any fainting spells?
Nope.
Have you experienced any sensations of feeling off balance? Have you had any difficulty in your overall vision?
No.
Okay. Have you had any decreased sharpness, blurring, blind spots, double vision, redness? swelling or any watering from the eyes or any discharge?
Nope.
Have you experienced any recent pain to either of your eyes? Do you have any history of eye diseases such as cataracts or glaucoma?
I do have an astigmatism. I don't know if that'd be considered a disease, but I do have that.
Okay. What age were you diagnosed?
Probably like 5th grade. I'm not sure what age I'd be.
Okay. I see you wear glasses.
Yeah.
When was your last eye appointment?
It was.
Or when was the last time you had your eyes checked?
It was this year. I had the glaucoma test also done. That was probably July, I'd say.
Okay. How often do you get eye examinations done?
At least every 2 years, but lately it's been every year.
Okay. Do you wear contacts at all?
I did a few years ago, but not this last time. I didn't get them.
Okay. Do you have any eye disabilities such as are you legally blind? Okay. Have you recently or in the past, have you had any ear pain, ear infections, discharge, ringing in the ears, or feelings of being off balanced?
When I was in, I think, 10th grade, I had like a swimmer's ear type infection, but that's all.
It's been resolved.
It's been resolved.
Yeah. Did you have to see anybody frequently as far as being on antibiotics or any medications for them? Or
no, we just bought a non-prescription type remedy for that.
And it took care of it?
Yep.
Okay. Do you wear hearing aids?
No.
Okay. Have you experienced any unexplained or sudden hearing loss? No. Are you exposed to any noise that could potentially damage your hearing in the future?
No.
Okay. How often do you clean your ears?
At least every other day.
Okay. And what method do you use? How do you actually get all the curcumin or all the earwax out of your ear?
Just the cotton swabs, and I usually don't try to go too far.
Okay.
I usually go just down.
Okay. Any recent nasal discharge? Have you experienced any cold or flu-like symptoms? Have you experienced any pressure in your sinuses or like the forehead, up by the nose?
Not recently, no.
Okay. Have you experienced any nasal obstructions? Meaning, have you had any blockages in your nose?
Not recently, but probably within the next few months.
Any unexplained or recent nosebleeds?
No.
Have you experienced any allergies, including seasonal allergies or food allergies?
Yes.
Okay, what are they?
I don't have any food allergies, but I do have seasonal allergies. Pretty much, it seems like late fall, early spring.
Okay.
Every year.
At what age do you remember this starting to occur?
At least middle school.
Okay. Do you take? I'm sorry. Go ahead.
I've had it for as long as I can remember.
Okay.
Basically.
Do you take any medications for it, Claritin or Zyrtec?
I usually take both Claritin and Flonase, the nasal spray.
Okay. Have you ever had any difficulty with smells as far as when if you're home cooking and you just can't smell anything? Okay. Have you ever experienced any frequent sore throats, mouth pain, bleeding gums, or toothaches?
No.
Have you ever felt skin lesions in your mouth or on your tongue?
No.
Have you experienced any difficulty in swallowing?
No.
Have you noticed any hoarseness in your voice or increased hoarseness? No. Can you describe your daily dental routines?
I try to brush twice a day, but at least once, mostly twice, though, and mouthwash.
Do you floss at all?
I don't floss.
Okay.
Rarely.
How often do you go see a dentist?
Well, my mom works at a dentist office, so every 6 months.
Okay. All right. Do you use any dental bridges or dentures?
No.
Okay. Have you experienced any unexpected or sudden neck pain?
No.
Have you noticed any difficulty in moving your neck?
No.
Have you noticed any lumps or swelling to your neck?
No.
Have you noticed lately any enlarged or tender lymph nodes? Have you noticed any goiters on your neck? And a goiter it's a really large mass. It's right in the front of the neck. It indicates your thyroid. It's basically swelling of your thyroid, but it's right in the middle of the neck. Have you ever experienced a goiter?
No.
Have you ever experienced any pains in your breast?
No.
Okay. Have you ever noticed any lumps in your breasts?
No.
Any unexpected or unexplained nipple discharge? Have you experienced any rashes around your breasts?
No.
Do you have any history of breast disease, or have you had any surgeries on your breasts?
No.
Do you have any pain or tenderness to your armpits?
No.
Have you noticed any lumps in your armpits?
No.
Have you ever experienced swelling or rashes to your armpits? Do you perform self-examinations to your breasts and your armpits, searching for any lumps or anything unusual on your own?
No.
You don't do those? Okay. We do recommend that every 3 months you perform a self-examination just around your armpits and your breasts, just to make sure that there's nothing when you come in to see us, just in case if we miss it, you might be able to find it on yourself, so we do recommend that, okay? Have you ever had a mammogram?
No.
Okay. Do you have any history of lung diseases such as asthma, emphysema, or pneumonia?
No.
All right. When was your last TB test? And what a TB test is, in case you've never had one, they just put a really small needle, they inject a fluid under your skin, and then 3 days later you come and get it read. Have you ever had that done?
Yeah, I had it done this year.
Okay.
In August.
What were the results?
I didn't have this, so it was negative.
Okay. Have you ever experienced any chest pain during breathing? Have you ever noticed any abnormal sounds when you breathe, such as wheezing or any fluid that may be building up in your lungs?
No.
Have you ever experienced any shortness of breath?
No.
How much physical activity does it take for you to become short of breath?
Maybe 10 to 15 minutes, maybe 20.
Okay.
Strenuous activity.
Strenuous,
yeah.
okay. Have you had any recent cough? If so, or are you bringing up any mucus?
No.
Okay. Do you have any reason to suspect that you may have been exposed to any environmental toxins or pollutions in your area or at work?
Well, at home we have well water, so you never know. We haven't had it tested, so I guess I never know.
Any issues with your family with the?
No.
Do you recall ever having a chest X-ray?
No.
Have you ever experienced any chest pain?
No.
Have you ever experienced any chest heaviness or a sensation that your heart is racing?
No.
Have you ever experienced any blue discoloration to any part of your body before? No. Have you ever noticed any difficulty in breathing while exercising?
Maybe sometimes, but that's after 30 to 40 minutes.
Kind of what we talked about this.
Yes,
the strenuous exercise. Okay. How much activity would it take in order for you to experience difficulty in breathing?
Maybe if I was running on the treadmill, maybe 30 minutes.
Okay. Have you ever had difficulty in breathing while laying flat? Have you ever been woken up out of a sleep with difficulty in breathing? Do you ever have frequent urination throughout the night?
No.
Have you noticed any swelling in your hands, feet, or your sacral area?
No.
Do you have any history of heart murmurs, hypertension, coronary artery disease, or anemia?
No.
Have you ever had an EKG done before?
No.
Do you have any other have you ever had any other forms of cardiac diagnostics, such as cardiac stress test or echocardiogram? Have you ever experienced any coldness, numbness, tingling to any part of your body?
No.
Have you ever experienced any swelling to your legs?
No.
Have you noticed any discolorations in your hands or feet?
No.
Do you have any history of varicose veins or vein disease?
No.
Have you experienced any recent leg pain? No. Has anyone ever told you that you have vein inflammation? Do you have any wounds that have taken an excessively long time to heal or don't heal at all? Do you work?
Yep.
Explain your working conditions for me, as far as what is expected of you. Are you standing most of the time? Are you sitting most of the time? Are you running around? Are you walking? Kind of go into that for me so I can get a good understanding.
I work at a sub shop, so I'm mainly standing most of the time. Pretty easy working conditions overall, I'd say. but the standing can get strenuous on my feet and legs after like a say 7 hour shift.
Okay. When you are sitting, do you ever sit with your legs crossed for a long period of time?
I usually don't sit at work, so I don't think that'd be applicable.
Okay. When you are working, do you wear any protective clothing? Do you wear special orthotic shoes or anything to kind of keep everything aligned?
I don't.
Describe your posture when you do sit. Are you sitting? Are you hunched? Are you more erect, upright?
I try to have an upright posture, but I think I do tend to slouch at sometimes.
Okay. Any back issues or back pain?
No.
Okay. How's your appetite?
I'd say normal.
Can you kind of go into normal for me?
Like how much?
Yeah,
regularity,
maybe calorie
schedule.
intake, daily calorie intake. Are you getting all the food groups in?
I'd say I lack a little on the vegetable aspect, but I've never counted my calories throughout the day, except maybe a few times. Probably about 2,500 to 3,000, maybe.
Okay. Do you have any food intolerances or allergies?
No.
Do you have any problems with swallowing?
No.
Have you ever had any problems with heartburn, indigestion, or pain during eating or shortly after eating?
No.
Do you experience any frequent abdominal pain? No. Have you ever had sour taste in your mouth with accompanying liquid? Kind of like you've thrown up, what people say, throwing up in your mouth.
Rarely.
Rarely. How often would you say that happens?
I don't know, maybe 3 to 4 times a year, not very frequently.
And have you noticed it's after a type of food that you eat?
Mm,
Or is it just kind of random?
I'm sure there's like a correlation, but it seems kind of random.
Okay.
It happens so infrequently that I don't notice.
Have you ever vomited blood?
No.
Do you have any abdominal issues? Have you ever had like appendicitis? Do you have ulcers, Crohn's disease, gallbladder issues, liver, yellowing of the skin, colitis, anything you can think of?
No.
Have you experienced any frequent flatulence or more than normal?
No.
Okay. How many bowel movements do you have per day?
Probably 1, I'd say on average.
Okay. Any recent changes in your bowel movement schedules?
No.
Have you had any recent changes in stool, such as color, consistency, any noticeable blood in your stool? Have you ever noticed any black tarry stools recently or in the past? Have you experienced any rectal plane bleeding or itching? Have you ever experienced any hemorrhoids? Have you ever had any surgeries to your GI system? Do you use antacids? Okay, do you use laxatives? How many times do you urinate in a day?
I don't know. Probably like 4 to 5, I'd say.
Okay. When you do urinate, how badly do you have to go? Is it something that you can kind of hold, or is it something where you're like, okay, I need to go right now, or I'm not going to make it to the bathroom?
I'd say most of the time I just go inconvenient, so it's not anything urgent ever.
All right. Do you recall ever having to wake up at night to urinate?
Rarely.
Can you kind of give me like how many times per night, or how many times per week, month?
Probably
year?
Maybe twice a month.
Twice a month.
It's
So it's not an issue. Okay. Have you ever had any recent changes in your urinary output, meaning how much actually you pee out?
Nope.
Have you experienced any frequent urination?
No.
Have you ever experienced any difficulty in urinating?
No.
Have you ever had trouble getting urine to come out? Have you ever noticed any narrow streams of urine? Have you noticed any cloudiness, blood, or dark urine?
Sometimes it's cloudy. Most of the time it's clear, though.
Can you explain to me, have you noticed like a correlation if you just don't get enough water, or something that you eat or drink that maybe causes the cloudiness, or it just kind of happens at random?
Usually it seems when I don't have as much water.
It's okay. Have you ever experienced any issues holding your urine?
No.
Have you ever had any urinary diseases such as kidney disease, kidney stones, urinary tract infections?
No.
Have you ever experienced any pain to your sides, groin, lower abdomen, or lower back? Do you take any measures to prevent UTIs as far as do you clean well after defecation or urination? Any measures at all?
Yeah, I'd say so.
Have you in the past or recently experienced any pain in the penis or testicles? Have you noticed any swelling, lumps, masses, rashes, itchiness to your groin, penis, or testicles? Have you noticed any discharge from the penis? Have you ever experienced a hernia? Are you currently in a relationship involving sex? Have you ever noticed any changes in your erection or ejaculation? Have you noticed, are you aware of any contact with a past partner that may have had an STI or STD? In past relationships, have you used protection when having sex in intercourse?
It hasn't been applicable.
Okay. Have you ever had any history of arthritis or gout?
No.
Have you ever experienced joint pain, stiffness, or swelling? No. Do you have any known deformities anywhere in your body?
No.
Is your motion ever limited, and have you ever heard any noises with normal body movement? So, meaning you're rotating your shoulder and you can hear abnormal noises coming from your bones or joints.
Just so once in a while it cracks or something, but nothing frequent or major.
Okay. Have you ever experienced any muscle pain, cramps, weakness, or any difficulty in walking?
Probably about 3 or 4 years ago now, I had I think it was the gastrocnemius muscle would tense up.
Okay.
Every night when I was about to go to bed.
What time did this occur? Or how old were you when you noticed this?
I don't know. Probably 12 to 13. I'd
Okay.
say.
Did you get it looked at by a physician or advanced practice nurse? Okay. Is it at this point resolved, or does it still occur?
It happened for about a month. I probably should have had it looked at, but
it's not an issue anymore.
It seemed like it would usually help if I massaged my leg muscle.
Okay.
It seemed to fix it.
Have you ever had any issues coordinating your movements? Do you have any history of back pain or issues with the discs between your vertebrae?
No.
On average, how much walking do you do per day?
Ranges from probably about 15,000 to 20,000 steps.
Okay. Do you have any issues with daily mobility? Do you use any assistive devices such as a cane or a walker? What effect does this lack of... Moving on. Do you have any history of seizures, strokes, fainting, or blackouts? Do you have you ever experienced any weakness, tics, or tremors? Have you ever experienced where you were unable to move any part of your body? Do you have any issues controlling your body movements? Have you ever experienced any numbness or tingling to any part of your body? Have you ever had any issues with short or long-term memory? Have you ever experienced feelings of disorientation in the past? Have you experienced any nervousness, mood swings, hallucinations, delusions, or depression? Have you ever been diagnosed with any mental or psychiatric conditions? How easily does your skin, lips, nose, or your eyes bleed?
Never really had that issue.
Okay. Have you ever experienced any excessive or unexplained bruising? No. Have you ever noticed any lymph node swelling? No. To your knowledge, have you ever had any exposure to toxic radiation? No. Have you ever had a blood transfusion? No. Okay. Do you have a history of diabetes, or have you ever had any frequent urination, excessive hunger, or excessive urination? No. Do you have a history of thyroid disease? No. Is it ever hard for you to tolerate heat or cold?
No.
Have you ever noticed any changes in your skin color or texture?
No.
Have you experienced any excessive sweating or unexplained sweating? Have you ever noticed a correlation between your weight and your appetite?
Not really, no.
Not really.
No.
Have you noticed any abnormal hair patterns or abnormal hair loss? Have you ever experienced any nervousness or anxiety? Have you ever noticed any, or have you ever had any hormone replacement therapy, or has hormone replacement therapy ever been recommended to you? All right. Well, thank you, Brad. That concludes questioning. Do you have any questions for me?
No.
All right. Thank you.
Thank you.